That's the purpose of today, and update, as always, at these press conferences, and now look forward to answering any questions.
Hi, Governor. Scott Schaefer from KQED. I'll be asking questions today on behalf of journalists across the state and beyond. No surprise, a number of outlets are curious about your thoughts on President Trump's comments today. He called churches essential and said that he'll override governors who do not allow houses of worship to resume in-person services immediately. And as you know, there were some 1,200 churches in California that have announced their intention to ignore the shelter-in-place directive. So what is your response to the president's statement, and what is your plan for churches? I know you said you're going to be saying more on Monday or even sooner.
Yeah, no, we said, going back the beginning of this week, we've said a lot in this space that we've been engaging faith community. We look forward to churches reopening in a safe and responsible manner. And we have guidelines that we anticipated completing on Monday, and we're on track to do just that. We appreciate the CDC is apparently going to be providing today, we're told, some recommendations. We'll take a look at those, but we haven't waited around for the federal administration's recommendations in this space. We take the issue very, very seriously and to heart, and we have been very aggressive in trying to put together guidelines that will do justice to people's health and their fundamental need and desire to practice their faith. And so we are looking forward to a very positive working relationship with faith leaders as we make public those documents, and look forward to working through this issue in the spirit of cooperation and collaboration.
Any response to what the president said?
I think that was an adequate response.
All right. KCRW-TV in Sacramento is asking, did you work with casinos that are reopening? What is your message to those large groups?
Yeah, we're close, as I said as well on Monday, that we believe around the 8th of June, plus or minus. These days are just 10 poles of approximate timelines where we are putting out guidelines, not just for casinos, but card rooms as well. Had some wonderful phone calls within this sector, tribal leaders just a few days ago, 100 plus tribal leaders getting their feedback, and they're helping us organize the guidance. They have been incredible in terms of not only being supportive of the engagement, but providing us some incredibly enriching and robust ideas on public health. One of the largest tribes in the United States that happens to be here in the state of California has been consulting with Johns Hopkins University, been working very collaboratively with their county health director. They provided us some really remarkable and robust and detailed ideas that we believe can be advanced as best practices across the sector. It's just an example of the collaborative spirit. I know there are a few here and there that have decided to move a little bit earlier against the advice of their local county health directors, but the vast majority are working very collaboratively with the state, and we're looking forward to putting out those guidelines in just a matter of days and weeks.
Governor, a question from Jeremy White at Politico. As you know, there was a lawsuit filed yesterday by congressional candidate Darrell Issa and others challenging the legality of your vote-by-mail executive order. How concerned are you about that adding uncertainty to the November election, and will you push for legislation from the state legislature to be on firmer legal ground?
No, we're on firm legal ground. Vote-by-mail is not novel in the state of California, nor was it in a recent special election, but we're confident in the effort. We believe it's the right thing. We also believe it's a nonpartisan issue. Public health is a nonpartisan issue. We want to keep people safe, and you'll still have points of contact for people that are disabled. People that are not as familiar with vote by mail will still have those points of contact for in-person voting opportunities. But we needed to move forward, sense of urgency, so we can prepare for the election. Many people know Utah, hardly a liberal state, has been doing vote by mail for years, not just Oregon and a few others. I think there's 5+ states that do vote by mail. But I think it's a responsible thing to do, to encourage people to vote and have an alternative to waiting in line and potentially, especially going back into the fall and experiencing a second wave that could put that election at risk. I think elections are too important. I think Mr. Issa's election's too important.
So just to affirm, you do not need the legislature, or you don't think the legislature needs to weigh in at all?
I think it's always healthy when people weigh in, and the extent the legislature, which by the way, trust me, weighed in, worked very collaboratively with us on the executive order. More importantly, it's been working very collaboratively with the Secretary of State, and we appreciate their work, and the extent they want to codify it, I think that could help as well. Why not?
Question from my colleagues at KQED. The state's guidance still directs Californians to, quote, not gather with any number of people who are not members of your household. Do you expect changes to guidance around small gatherings, and how does this fit into the reopening roadmap you've created for businesses and schools?
Yeah, this all is part of an iterative process. We said it's a dynamic process, and all of this will begin to change. Every single point of reference, specific and general, that's reflected in that stay-at-home order, we expect it to change. So the answer is yes, we expect that to change. By definition, this is not a permanent state. We are in this current stay-at-home order because of a state of emergency, because of the spread of COVID-19. It wasn't last year. It was just a few weeks ago that this was brought to everybody's attention in very acute ways, including the president, who universally was focused on the needs of states, ventilators, personal protective gear, and actually was criticizing, I think, one state for moving too quickly to reopen just a few weeks ago, not years ago. It's a way of expressing this. I want folks not to develop amnesia that this disease is still with us, and people literally are dying. People are losing their lives, including 88 families completely destroyed this Memorial Day and are mourning for the loss of a loved one. And we need to protect people, and to the extent that we are guided by health, we are, by science, by data. A lot of good data coming out in terms of stability and spread, but that's because of the extraordinary work of 40 million Californians practicing physical distancing. I just encourage them to continue to do the same, and the more we do to stabilize the situation, the quicker we'll be able to move forward with those modifications. But again, this is not months and months of a permanent state. It's a dynamic state, and every week, we will be making modifications, we anticipate, to that stay-at-home order as we did this week and have previewed for next week.
Governor, a question from Associated Press. Assembly Budget Chair Phil Ting pointed out today that the state doesn't declare emergencies and give you complete authority to do whatever you want. Then those may be his words. When we're fighting things like heart disease and cancer, the question is, now that we are 2 months into this pandemic and the number of hospitalizations have stabilized, do you still believe you need these emergency powers to spend public money with little oversight? Why or why not?
Well, there seems to be a lot of oversight as it relates to those things, contracts being made public. I think 5, 6, 7, 8, 10 hearings that have been conducted. So I think that's encouraging. I encourage it, and I think it's appropriate. And I look forward. I've been looking forward to the legislature coming back for months now. And so there are plenty of things that are on my desk that I'm happy to hand over in terms of issues that need to be addressed. And I look forward to engaging them, as I've engaged the chair of the budget personally, directly on multiple occasions over the last many weeks and certainly many days, including a number of recent meetings related to the budget. And I applaud his oversight and his stewardship.
Question from Brody Levesque at the LA Blade. A report from the Williams Institute at UCLA School of Law found that over 200,000 LGBT people in California have one or more medical conditions that put them at high risk of COVID-19, including HIV. There are still no data points forthcoming as promised by your administration in regard to the pandemic's impact on the LGBTQI community. Will you issue an executive order to implement the necessary changes to commence gathering these critically needed data points for the impact?
What I love about that question, it's a wonderful bookmark. The previous question was, Governor, need to work with the legislature. This question is, how can you bypass the legislature and sign an executive order? As I just said in the last question and answer, I'll answer it consistently. I look forward to working with the legislature. I've now on 4 separate occasions been asked that question specifically. On 4 separate occasions, I expressed a deep desire to reconcile this, but also was very specific about how proud I am to work with Scott Wiener, who's got a bill on this, and working with Scott and many other members of the legislature, including the LGBTQ caucus, of which I had the privilege of spending some time with a week ago. They have a bill. They would like to advance that bill. We are working very collaboratively to do exactly what needs to be done, and that's to reconcile an historic fact that predates the current pandemic, and that is the issue of data collection, the lack thereof in the LGBTQ community.
Question from Doug Sovereign at KCBS. Many hospitals and medical professionals are still struggling to procure adequate PPEs and are even reusing masks. I know you said millions of masks are in the pipeline, but how are restaurants and retail stores supposed to compete to get masks, sanitizer, and other protective equipment they need in order to reopen safely under the new guidelines?
So over 2 weeks ago, in fact, 2 weeks ago to the day, I believe we announced, though the days and weeks go by, so I may be off, we announced 11 million masks had been distributed just on that Friday. I announced exactly where they were distributed. You may recall we distributed to Department of Education masks, to in-home support service workers, to our child care facilities. We announced millions and millions of masks went to farm workers in this state, and I also announced millions of masks went into our food sector, including grocery stores, not just large chains, but desire to get into smaller grocery stores. The reason I went through that litany a few weeks back, the reason I highlighted those 11 million masks was not in anticipation of that question, but in recognition of the need to provide more personal protective gear so that we can reopen our economy in a much more swift, robust way. The reason I began today's comments by mentioning the 80+ million procedure masks that have come in was to basically double down on our not only recognition of the importance of appropriate levels of personal protective gear, beginning substantively with the issues of masks, but to make the case, as I've made earlier this week and in multiple occasions over previous weeks, that we need to get those masks out, not just within the hospital system and the alternative care system, but now into the economy. And that includes to sectors of our economy. They include those that were highlighted in the question, but also additional sectors of the economy, including salons. As you may have noted, a week or so ago, I announced that we were within a week, we still are, now days, of announcing a loosening of our stay-at-home order for barbershops and for salons. We now have a constructive process as it relates to personal care industry broadly defined and making sure we get feedback to put out guidelines in that space. PPE is a big part of that conversation, the extent that the state of California can service that gap, recognizing how difficult it's been for everybody to procure PPE. That is exactly what we have done and intend to continue to do.
Governor, question from Jacqueline McLean of KFSN ABC 30 in the Central Valley. What actions will the state take against counties that reopen into Phase 3 without state approval? For example, just this week, the Tulare County Board of Soups voted to allow its county to reopen into Phase 3, yet the county continues to see high daily positive test results and deaths.
Yeah, it breaks my heart. It should break your heart. Families of loved ones that are impacted, that may not have been impacted by COVID-19, may have a loved one lost their life, would not otherwise lost their life because people aren't working in the spirit of collaboration with their health professionals that understand the virulence of this disease and understand the consequences of being flippant about the moment. I'm deeply sensitive and I have deep admiration and respect for the elected officials in Tulare County. I want them to know that. And I want them to know I understand their deep desire that I share to reopen every aspect of the economy and go back to normalcy that we had just 100 days ago. And as they are well aware, we are working collaboratively with them, but they want to go deeper into the next phase against the advice of a lot of our health officials. And to the extent we'll continue to collaborate, continue to cooperate, we may have areas of disagreement. By the way, it's interesting, the county officials have disagreement with a lot of the city officials, where the city officials are saying, don't put this pressure on us, we don't want to go as quickly. So it's a dynamic that will work itself out. This isn't, again, an exception. Overwhelming majority of counties are working very, very collaboratively. I don't wake up to look to be punitive. I want to be responsible and respectful to the deep economic challenges that all of us are facing, and that's why the vast majority of the sectors of our economy have opened. But again, these modifications, I know, are difficult and are very vexing for business leaders as they navigate these very, very difficult times. And so I just want to reflect an empathetic, a sense of empathy and understanding to those that have disagreements, and respect. But I hope that they know we look forward to working with them, and I don't take comments and resolutions personally.
Governor, a question from Joe Matthews from Socolow Public Square. Before COVID, a third of Californians, including half our kids, were on Medi-Cal. Now those numbers are going up even more. Is Medi-Cal really strong enough to serve 14 or 15 million Californians and to get them timely access to high-quality health care? Is it sustainable?
It depends how you define sustainable. It's situational. Situationally, we're required to do more and do better. And so the answer is, in the current short term, yes, we have to absorb those responsibilities. But there are trend lines over the course of decades as it relates to adequacy of care, cultural competency of care, geographic disparity of care, need and desire to train more doctors and have more rural areas of support, reimbursement rates in that space. We had made a lot of progress in the first year of our administration. I compliment Governor Brown for the progress he made in his administration. We have a blueprint for real reform. It was referred to in my State of the State and in my January budget as CalAIM. It was a $695 million appropriation to CalAIM that I was hoping to make this year. Working with Budget Chair Phil Ting and others, we felt it was inappropriate, with all of the magnitudes of the cut, to put forth those reforms at this stage because of the change in economic conditions. But I'm committed long-term to those reforms. So the answer to the question is long-term, no, but we're not committed to the status quo long-term. We're committed to reforms. We have the architecture, CalAIM, for those reforms and the supports that we provided in terms of reinforcement rates, new medical schools that we want to put up, the work we're doing to reimburse people that support Medi-Cal beneficiaries and paying off their medical debts, a whole panoply of reforms that are part of our package of substantively answering a very profoundly important question that deserves more than just a soundbite response.
Governor, last question from Kevin Yamamura of Politico, and it's one I think a lot of parents are wondering about. Will summer camps and day camps be allowed to open this summer?
Yeah, we're working very, very closely. In fact, I was just talking to the head of the California Teachers Association as just one example, but profoundly important example of leadership in this space, reflecting his members' concerns and reminding me of what I think all of us should be reminded of, and that is the nature of our system that's so decentralized throughout the state of California. Not only are we 58 counties, 470, almost 480 cities, but we're over 1,000 school districts in the state of California, independently led, with a deep appreciation and recognition that localism is profound as much as it is pronounced. The LCFF process that was developed under the previous administration went very specifically to this framework and advanced that cause, I think, in an appropriate way. So will the cause of reopening, recognizing that it's a bottom-up process, not a top-down process. It's a long way of saying this, that we have been working with many, many stakeholders in this space, not least of which the Superintendent of Public Education, the head of the state school board, Linda Darlene Hammond, many, many others, to work to put out guidelines, not only for reopening schools with the flexibility that are required to address learning loss associated with the end and the disruption of our school year because of COVID-19, but also in the space of summer schools. We have guidelines that will be updated. We already have had guidelines out and have been updated on multiple occasions for child care facilities. Those will be updated and out next week as well. We have summer camp and summer school guidelines that we're also working on. Expect many of those guidelines to be made public within a week or so. I want to give people plus or minus this 3-day holiday may delay for a day or two, but we are working very, very aggressively to make sure it's an inclusive process and to make sure before we put something out that people feel comfortable with what's put out and there are no big surprises. I'm a parent of 4. My oldest is 10. Youngest just turned 4. And I can assure you a big part of the tradition in my family are summer camps. We're becoming more and more of a tradition of summer school. And the issue of learning loss is profoundly important to me as it is millions of others in the state of California. I deeply want to be able to answer the question my kids ask me as well as kids all across, when can I go to camp or can I go to camp? And if summer school is going to open, what's it going to look like? I just did a PSA for LA Unified School District as one example on their summer school effort, but a lot of that was around distance learning in that space. So again, this is a dynamic space, and one has to recognize the regionalism and the localism that defines the education space broadly, as well as the variations that are being advanced as it relates to public health and public safety through our modification of the stay-at-home order that will also be determinative in terms of recognizing the needs of summer camps and the public needs and public health, not just safety of our children. I want to thank everybody, as always, for the privilege and opportunity of sharing some of these thoughts and updates with all of you. We are making progress reopening this economy. Make no mistake, we are moving these modifications forward, and meaningful modifications are being made, and you're seeing that translated in not only new guidelines, but the opening of restaurants throughout the state of California, retail throughout the state of California, soon churches, places of worship throughout the state of California, and it can't come anytime too soon. We hope our schools in a safe and responsible way, protecting our caregivers, protecting our teachers, protecting our support staff, and our students and their parents, always top of mind before we move aggressively in that space. I encourage everybody, as you move forward aggressively into a beautiful weekend that usually brings people together, please, to the extent possible, stay regionally, stay close to the cohort that you've been with. To the extent you go out, and you should do so thoughtfully and abide by local health considerations and guidelines, and wear face coverings as appropriate. But I hope you do so safely and enjoy yourselves. We are beginning to turn the page, not only in this country, but substantively in this state. And I really feel confident that the best is yet to come. But again, that's a sober point, and I don't need to remind you that it'll be our decisions that will determine that fate and that future. And so continue to do the great work all of you have done, and let us take time, all of us, and pause and reflect that freedom is not something that we just inherit, something you got to fight for, something you can't take for granted. And let us remember our heroes, those warriors, those folks that had one cause in common, and that was the cause of freedom, to protect our liberties and to protect our way of life. And that's why we're here, in their spirit and in that light. And we hope you reflect upon millions and millions of Americans' best this weekend and enjoy your Memorial Day. Take care.